Community Analysis of Dunedin presented by Adrian Filanowski, Shannon Barrett, and Linda Hunt. The Dunedin community lies within Pinellas County. Pinellas County was discovered in 1528 and separated from its neighboring Hillsborough County in 1912. Dunedin became discovered in 1852, but not until 1899 was it incorporated into a town. This involvement included the construction of its first post office. Dunedin's waterfront location allowed the development of a port used for trading. This port then grew to be one of the young state's chief trading centers. The Dunedin community has developed into a town sufficient enough to provide members with all their needs. East Dunedin Hospital was established in 1937 and is currently a 143-bed facility. This facility is currently undergoing expansion and renovation to allow for more areas of care, including a new critical care unit, preoperative holding unit, and post-anesthesia care unit. Tourism is a major economy booster located in Main Street. Many shops staggered next to one another allow for souvenir shopping and places to eat. The Dunedin Causeway has also become a favorite for individuals to enjoy the sunset, fish, perform water sports, or simply just enjoy the water. Main Street is often the location to be during events, as it is often closed down for those. Some of these events include parades and art shows. An upcoming event during March 17 is the tradition of St. Patrick's Day. The streets will be closed, food will be served, and the Dunedin Pipe Band will roam the city playing bagpipes. Parking in downtown Dunedin is in need of improvement. While previous parking was free, meters are now in place as a way to generate revenue. The revenue is estimated to be nearly $400,000 and will be used towards maintenance costs. On the other hand, some business owners are against the change. They believe the cost to park, along with limitations on time, will decrease their sales. I believe Dunedin will benefit from a homeless shelter. However, there are resources located right outside of the community in Clearwater. There are multiple treatment centers, rehabilitations, and services in place for the people of need. The median annual household income in Dunedin is estimated to be about $45,618. This places the community at mainly middle class as well as slightly lower income than all surrounding communities such as Clearwater, Tampa, and St. Petersburg. Clinicians appear to be overwhelmed by the high clinician-to-patient ratios. Primary care physicians are 1 physician to 90 patients. Dentists are 1 to 66 patients. Mental health professionals are 1 to 171 patients, which gives the impression that the profession is in need. Florida is known for its beautiful beaches, with one of them being located here in Dunedin called Honeymoon Island. Many people participate in outdoor activities at these beaches, which involve being exposed to the sun for long periods of time. Excessive sun exposure puts individuals at risk for developing skin cancer, also known as melanoma. Nearly 330 diagnoses of melanoma are reported yearly in Pinellas County. In comparison, these statistics are similar when compared to other counties with many beaches, such as Palm Beach, with an annually reported 449 cases of melanoma. Smoking also becomes a concern since one of the leading causes of death in Pinellas County is lung cancer. Nearly 52% of Pinellas County residents have smoked at least 100 cigarettes throughout their lifetime. Based off a survey, alcohol consumption was the greatest area of concerns for individuals in the Pinellas community. This correlates with the finding that 68% of college students in the United States experience alcohol abuse at one point in their lifetime.
Analysis of adequacy of health-related resources and availability. Available resources are in Dunedin. The Dunedin community include but are not limited to providing free and low-income based health services at clinics. There are 10 located free and affordable clinics within the area of Dunedin that are accessible to not only the Dunedin residents but Pinellas County residents as well. They include but are not limited to dental clinics, women's health services, adult and pediatric health services, and behavioral and mental health services. These clinics are affordable to those who have low-income families and those who don't have insurance. Some examples of these clinics include, but again not limited to, the Willa Carson Health Resource Center that serves medical and women's health care needs, the Clearwater Free Clinic that has volunteer nurses and physicians that provide also basic needs to healthcare to individuals, and Homeless Emergency Project Dental Clinic that provides to the homeless and low-income families with essential and basic needs such as housing, food, clothing, and support services such as counseling. In relation to Healthy People 2020, there are three specific objectives related to health in the community that include access to health services, decreasing the risk of disease processes by eating healthy and staying active, and reducing the number of individuals that smoke in the community. These three specific objectives and their rationales: number one, to provide easy access to health services. Healthcare is essential for all individuals in order to live. Achieving health services for the community will increase health of individuals overall. Number two, decreasing risk of diseases in the community by promoting healthy eating and staying active. Diet and weight are greatly related to one's risk of developing chronic diseases in the future. By making schools, businesses, and the community, this will help citizens become more aware of their weight and diet by giving the community resources to provide affordable and healthy food. Number three, reducing smoking in the community. By reducing this habit of smoking cigarettes and other tobacco products, individuals reduce their risk of developing diseases such as lung cancer in the future and decrease their risk of being disabled. And reducing again and smoking in the community is also provides a better environment to breathe in and reduces the risk of others inhaling secondhand smoke. Analysis of the environment. There are adequate resources related to the environment and the community for Dunedin citizens. They include, but not limited to, beach cleanups and Green Dunedin. With beach cleanups, Dunedin offers different beach cleanups that are volunteer-based. Social media, such as Facebook, provides events and programs that give information about the times and dates these beach cleanups are at. Green Dunedin is a resource website for individuals that have a main goal of preventing waste disposal, recycling, and conserving natural resources. Some examples are listed below that include, but are not limited to, Green City program, which focuses on improving mediums such as energy, water, land, waste, and air, solid waste and recycling, water conservation, green building, green tips, and the WasteWise. Some issues that are related to the environment in Dunedin are pollution to our beaches and water. There are numerous amount of pollutants that come into the oceans that include microbial contaminants and organic contaminants, pesticides and herbicides, and organic chemical compounds. Some examples are listed below, such as microbial contaminants are viruses and bacteria, and organic chemical compounds may be byproducts of the industrial processes.
Dunedin operates under a nonpartisan commission manager form of government. It consists of a mayor, 4 commissioners, and a city manager. All community officials can be contacted through email or phone number. Typical response time is 1 business day. In addition, Dunedin has both Facebook and Twitter accounts. The typical response time by an individual is 1 hour. Commission meetings are held the first and third Thursday of every month at 6:30 p.m. Attendance is high, particularly by retired individuals and city workers. Commission meetings are broadcasted live on Dunedin TV and can be viewed daily at 9 and at 6:30 p.m. These meetings can also be viewed online at Dunedin's website on demand. Dunedin does a good job in taking into account all aspects of the city's needs. Some examples of allotted funds are community redevelopment, building, stormwater, solid waste, facilities maintenance, parking, health benefits, risk safety, marina, and stadium, just to name a few. The focus on Dunedin's 2018 budget is on the stadium reconstruction, building a water treatment plant, pavement management program, golf cart barn reconstruction, and fleet fund. One proposal to Dunedin's economic development plan is to renovate Dunedin Causeway. Renovating the area would be good for tourism, but there are some limitations and threats that need to be evaluated. There is a lack of businesses that support recreational activities, and the city's vision may not be supported by code. There is a threat of inappropriate use of space, and the replacement of the bridge could impact the size, and homes could be torn down. Another proposal is to renovate downtown Dunedin. One limitation is access to parking, and office space is limited. The need for affordable housing to support economic development is more important. A threat is new development does not always support the vision. The Code of Ethics and Dress Code are two policies directed at city employees. The purpose is to ensure they promote professional appearance and act in a proper ethical manner. Soliciting or accepting gratuities or showing favoritism or discrimination is not tolerated. Dressing appropriately projects a professional image. This is a good thing because this is a direct reflection of Dunedin. A person's decision to drink is influenced by the availability of alcohol in the local area. When bars are in a close proximity of a person's home, studies have shown an increase in alcohol consumption, increasing the potential of driving under the influence, putting everyone's health at risk. Lack of public parking puts more pedestrians on the street. Individuals 65 and older account for 20% of pedestrian-related fatalities. Children between the ages of 5 and 15 account for 22% pedestrian fatalities. Adding more parking options would help decrease the amount of pedestrians and reduce potential health-related problems. Cigarette smoking is the leading cause of preventable death in the United States. Non-smokers who are exposed to secondhand smoke increase their risk of developing lung cancer by 20 to 30%. In addition, secondhand smoke also increases the risk of heart disease and stroke. The Centers for Disease Control and Prevention estimates 2.5 million non-smoking adults have died because they breathed in secondhand smoke. 1/3 of all United States workers are paid less than $12 an hour. Approximately 25 million individuals utilize food pantries, and most depend on a local food pantry as part of their regular survival strategy. Dunedin Care does a good job, but donations are needed. There is a 2-mile cutoff required to ride the school bus. Many students walk or ride their bicycle to school. This is a problem. 22% of school-aged deaths every year are contributed to bicycle pedestrian-related accidents. Children exposed to traffic pollution are more likely to have asthma, permanent lung defects, and higher risks of heart and lung problems as adults. Overcrowding can cause a 21% risk increase in anxiety disorders. Living in a crowded area is associated with increased social stress. Increased anxiety and stress lead to a lack of sleep, chronic fatigue, and can compromise the immune system and jeopardize health. I chose this order because I believe that the amount of bars in Dunedin tend to impact on the rest of the problems.